Put yourselves back into bed this morning. What are the first things you did? You probably brushed your teeth, put on clothes, and fed yourself breakfast. Now, imagine having to work 40 hours a week with a therapist to develop these same skills. How would it affect your day-to-day life? These tasks seem quite innate for most people, but for people with autism, everyday activities can take months or even years to develop. This is because autism is a developmental disorder that affects many different systems. The mechanisms of autism are still frustratingly mysterious, but the signs are well known and include a spectrum of problems with social, motor, and language skills. As such, autism requires a wide variety of therapy, including speech therapy, instructional therapy, social therapy, and motor therapy. Today, I will be discussing one therapy of autism known as applied behavior analysis, which encompasses many different forms of treatment to give comprehensive care to autistic patients. But ABA has a heavy price tag and can cost almost $100,000 a year, posing great problems to families who are footing the bill. Health insurance companies are usually responsible for reimbursing the cost of these expensive treatments in exchange for regular payments from their customers. Today, I will argue that ABA must be better covered by health insurance programs to give autistic children the care that they need. But this argument comes with a series of questions, which I will address today. First, I will talk about what ABA actually entails. Next, I'll discuss why it isn't covered already by insurance. And finally, I will give 2 reasons why it goes beyond traditional medical treatment and should be covered. The first question is, what does ABA actually involve? It's difficult to assign a set definition to ABA because it varies so greatly to address individual needs. But in the end, ABA helps develop essential behaviors for autistic children, like taking care of themselves at home and learning how to communicate with others, things that they may not be able to learn on their own. But as we've heard, ABA comes at high cost. Low-income populations are particularly affected by the cost of ABA, having to provide for one child while struggling to support the rest of the family. Take Lisa Parles' case with her autistic son Andrew, for example. Andrew, who is now in his 20s, has been in ABA since he was 3 years old, with Lisa paying out of pocket for every treatment session. Eventually, the costs were so high that Lisa had to leave her job in Arizona and move to another state that mandated ABA coverage under health insurance policies. The treatment was clearly essential to Andrew's development. Without it, Lisa says that Andrew wouldn't be brushing his teeth, showering, or getting his own snack by himself. But why did Lisa have to leave her job and move for better ABA coverage? Why wasn't it covered in the first place when it seems like such a useful treatment option? Well, health insurance companies like Blue Cross Blue Shield comment that ABA is educational and not medical, and therefore is not applicable under health insurance policy. What exactly do they mean by medical, though? Michael Gans, who is a health economist at the Harvard School of Public Health, explains that direct medical treatment is professional, clinic-based service that include things like physician visits, emergency care, and prescription medications. ABA, though, is not necessarily clinic-based. It does require a significant amount of teaching and training to help autistic children adjust to their environments. So sure, ABA is educational in nature, but that doesn't mean it should be excluded from health insurance policy. Some states do recognize this fact and include ABA in their mandates for health insurance policies in their states. These mandates are described in a report from the National Conference of State Legislatures. But when states do mention ABA in their policy, they have some strings attached. Annual spending caps of around $50,000 are prevalent throughout the policy descriptions, which, as we've learned, only covers ABA only covers half of what ABA can cost in 1 year. So it seems like state insurance mandates recognize ABA as a useful treatment option, but still value medical treatment over educational programs. But medical treatment, as described by Michael Gans, seems quite limited to the clinical setting. ABA, however, will be able to address everyday needs of people like Andrew. With the research I've done, I will emphasize the need to bridge the gap between autism coverage and cost by showing how ABA goes beyond medical treatment for autism. It does so in two main ways. First, ABA uses learning strategies that are tailored to autism. And second, it simply starts at an early age. ABA is tailored to autistic learning strategies in its breakdown of complex social tasks into simple steps with repeated practice. For example, learning how to hold a conversation may start with learning how to make the individual word sounds, then the words, then the actual statements. In his study for the Archives of General Psychiatry, Dr. Wayne from the Mount Sinai School of Medicine provides strong biological evidence on how this task breakdown strategy helps with learning social skills. He compares brain activity between autistic patients and normal developing males as they're asked to interpret a series of comics. They'd be shown something like this, in which Ed here sincerely says thanks a lot after he receives a shiny new pair of rollerblades from his aunt. Or they'd be shown another comic where Ed ironically says thanks a lot after he receives socks from the same aunt. In this case, autistic children aren't able to pick up on Ed's facial expressions and tone of voice to infer irony in his statements. Therefore, simply telling autistic patients to pay attention to the comics doesn't result in normal brain activity. But once they are told to pay explicit attention to Ed's tone and facial expressions, brain activity is significantly enhanced to help infer Ed's ironic intent. Dr. Wang's study shows that this strategy of breaking down complex social tasks creates efficient learning for autistic children and even results in near normal brain activity. As we saw with the conversation example, ABA involves exactly these types of explicit instructions to teach social skills. With practice, these instructions will help streamline the social interactions of autistic children. But practice takes time, especially in beginning ABA regimens. Remember the case of Andrew, who started ABA when he was 3 years old. It turns out, though, that simply starting ABA at an early age is also an efficient way to maximize learning. Mark Weber, who's a law professor at DePaul University, explains that ABA therapy can help integrate autistic children into their mainstream classrooms. He cites a lawsuit between an autistic child's family and their school district, which only proposed to provide 8 to 15 hours of ABA a week. The family demanded compensation for 35 to 40 hours of therapy a week. In the end, the court eventually ruled with the parents' side, mainly after seeing the progress of their child. With early ABA treatment, the child soon became the most academically advanced child in her private mainstream classroom. Not only did ABA help her adjust and become accustomed to her regular classroom, it also enabled her to thrive and excel like her peers. From an economic standpoint, early interventions help reduce what Michael Gans calls indirect costs of autism, which are mainly the income loss of autistic individuals and their caregivers over the course of their treatments. These costs can grow up to $1.8 million over one's lifetime. Therefore, starting early with ABA allows autistic children to better reach their potential and also increases human productivity later on. To summarize, ABA therapy provides essential skills for autistic children to function in mainstream society by using appropriate learning strategies and starting early in the child's life. ABA is more sustainable than clinic-based treatment because it helps develop lifelong skills and reduces income loss later on. With more awareness of the benefits of ABA, we can provide more funding to the treatment and help bridge the gap between ABA coverage and cost. Better insurance coverage of ABA will no doubt reduce costs later on, but more importantly, it allows autistic children to thrive and adapt in their environment. This is a priceless right that is worth the investment. Thank you.